Come back to learning anatomy with Dr. Bakare. It is another quiz time, and in this section, we would be looking at some structured questions that are related to the clavicle. This will prepare us for questions related to this region in any examination. So ride on with me as we look through this. The first question we'll be looking at here is the clavicle is classified as a dash. The clavicle, is it classified as a long bone? Is the clavicle classified as a short bone? Is it classified as a flat bone or a sesamoid bone? Out of all these options, the correct answer here as it relates to the classification of the clavicle is the long bone. The clavicle is a modified long bone, hence this is the correct option. Look at the second question, and this reads that the most commonly fractured site of the clavicle is dash. Is it the medial third? Is it the lateral third? Is it the middle third? Or is it none of the above? The correct answer here as it relates to the commonly fractured site of the clavicle is the middle third. So now let's go to the third question, and this reads that the anterior surface of the medial two-third of the clavicle is related to dash. Is it related to the deltoid muscle? Is it related to the subclavius? Is it related to the supraspinatus? Or is it related to the pectoralis major muscle? The correct answer here is the pectoralis major muscle. The anterior surface of the medial two-third of the clavicle is related to the pectoralis major muscle. Hence, this is the correct option. Now let's go to the fourth question, and this reads that the first bone to ossify is that. Is it the scapula? Is it the humerus? Is it the clavicle? Is it the radius? The correct answer is the clavicle. This is the first bone to ossify during the process of development. The fifth question here reads that the anterior surface of the lateral one-third of the clavicle is related to, is it related to the deltoid muscle? Is it related to the subclavius? Is it related to the supraspinatus? Or is it related to the pectoralis major muscle? The correct answer here as it relates to the anterior surface of the lateral one-third of the clavicle is the deltoid muscle. We know that the deltoid muscle is seen to form the contour around the shoulder region. And this is what is related to the anterior surface of the lateral one-third of the clavicle. Remember, we stated in our previous slide that the anterior surface of the medial two-third is related to the pectoralis major muscle. And it is important that we know the specific muscles that are related to specific regions. So now let's go to the sixth question, and this reads that the subclavian groove is located on the dash. The subclavian groove is an indentation that receives the insertion of the subclavius muscle. So where is it located? Is it located in the inferior surface of the middle third of the clavicle? Is it located on the superior surface of the lateral third of the clavicle? Is it located on the inferior surface of the medial third of the clavicle? Or is it located on the superior surface of the lateral third of the clavicle? The correct answer here, as it relates to the position of the subclavian groove, is the inferior surface of the middle third of the clavicle. This is where we have this indentation created. If you go through our lecture on the subclavius, we've highlighted this in detail. So you can go and check that lecture up to keep yourself updated. So let's go to the seventh question. The seventh question here reads that which of the following statements concerning the clavicle is correct? Is it the fact that it is a subcutaneous bone? Is it the fact that it is a long bone? Is it the fact that it's the first bone to ossify, or all are correct? The correct answer here is all are correct. All the above listed options, they are correct about the clavicle. Hence, this is the correct answer. For the eighth question, and this reads that the conoid tubercle is a prominence on the dash. Is it on the inferior surface of the medial third? Is it on the superior surface of the lateral third? Is it on the inferior surface of the lateral third? Or is it on the superior surface of the middle third? The correct answer here as it relates to the position of the conoid tubercle of the clavicle is the inferior surface of the lateral third. This is where we have this tubercle located. And this is what gives the insertion point of the conoid ligament. We've also tried to highlight this in details in our previous lecture on the clavicle. So now let's go to the ninth question, and this reads that the clavicle articulates with the manubrium at the dash. Is it at the acromioclavicular joint? Is it at the costovertebral joint? Is it at the sternocostal joint? Or is it at the sternoclavicular joint? The correct answer here, as it relates to the joint created between the clavicle and the manubrium, is the sternoclavicular joint. The sternoclavicular joint exists between the sternum and also the clavicle, but specifically it is seen at the manubrium of the sternum, and this is why it is referred to as the sternoclavicular joint. So it's important that we also highlight this. So now let's go to the 10th question, and this reads that the trapezoid bridge is on the dash. Is it on the inferior surface of the middle third? Is it on the superior surface of the lateral third? Is it on the inferior surface of the lateral third? Or is it on the superior surface of the medial third? So as it relates to the position of the trapezoid bridge, the correct answer here is the inferior surface of the lateral third. The trapezoid bridge is located close to the conoid tubercle, and they are both seen at the inferior surface of the lateral third of the clavicle. The trapezoid bridge also gives the insertion point for the trapezoid ligament. So now let's go to the 11th question, and this reads that the following concerning the clavicle is correct except the fact that it has two primary ossification centers? Is it except the fact that it is the only long bone that is horizontally placed? Is it the fact that it undergoes intramembranous ossification? Or is it except the fact that it has medullary cavity? All of the following options here are correct except the fact that it has a medullary cavity. The clavicle does not have a medullary cavity, hence this is the correct option. All the other options here are correct about the clavicle. It is seen to have two primary ossification centers, and it is the only long bone that is seen to be horizontally placed. It is also seen to undergo intramembranous ossification. So now let's go to the 12th question, which is the last question. And this reads that which of the following muscles is not attached to the clavicle? Is it the pectoralis minor? Is it the subclavius muscle? Is it the deltoid muscle? Or is it the pectoralis major muscle? Out of all these muscles, the pectoralis minor is not seen to be attached or connected to the clavicle. This is the only muscle that does not have a connection with the clavicle. The subclavius is located inferior to the clavicle. The deltoid and the pectoralis major muscle are seen to be connected to the anterior surface of the clavicle. So you see that all these other muscles are attached to the clavicle, except the pectoralis minor muscle. I hope you find this quiz useful, and thanks for watching. I'll be expecting your grades in the comment section.